Hello, Brunswick County and beyond. Dr. James Morosky here with Coastal Integrative Health here in Charlotte, North Carolina. And we're going to be continuing our talk on traction tables. In our past videos, we've already talked about inversion tables. We've already talked about flexion distraction tables. So that's where patients are getting turned upside down with the inversion tables, or they're lying flat and the bottom half of the table drops down to produce that traction effect that we're looking for. Today, we're going to be finishing off with talking about decompression tables, or what a lot of patients will call the rack. Almost medieval, but works out really nicely for patients that have either multiple disc herniations or they're dealing with stenosis. And stenosis is just essentially where the canal of that spinal cord, where that spinal cord actually starts to narrow down and it starts to compress the actual cord inside the spinal column. Especially if I've got patients with multiple levels that are affected, decompression works beautifully for them. It's able to hold that traction for a lot longer than what's humanly possible, and I can work on all those discs at the same time. This particular model is what's a Chattanooga Triton DTS system. Lots of different tables are out there that other chiropractors, physical therapists, medical doctors, neurologists potentially will utilize. But this is the one that we have available to us here. Now, on our particular model, we're able to work on the lower back by having patients lay down on the table, either face up or face down, and then just kind of strapping them in. And then that's where to pull down the pelvis with keeping the upper back pretty much stable, and it tractions everything in between. We also have the option to strap the patient in, their head, up through here, and it'll pull up on their neck. And then all we have to do is either adjust the table high or low to get different segments into the neck there. Now in this model as well, we're able to control how much pressure, or negative pressure really, that we're putting into the spine. And we also have customized settings in here that tell the system how often that it needs to pull, how quickly it needs to get up to that maximum pull, and how often it releases to pull again. So especially with more of an isolated singular pull, best for degenerative issues, best for stenotic issues, disc issues, where there's sciatica going down the legs. If I've got a patient with just chronic degeneration, chronic pain that has been unresponsive to other therapies, multiple pulls that come and go will tend to work best for those patients. Now, there are other models out there like the DRX 9000. We've had some patients call in asking if we have that table. Not too much of a difference between them. I kind of compare it to kind of the reliability of like an F-150 versus a Cybertruck. One's got a lot more bells and whistles on it. Patient just has to ask themselves, is it worth it for them? Certainly there are some things with the DRX that are nice. Video screens so patients can watch movies while they're getting their traction done. But since the session lasts about 15 minutes, how far are you really getting into that movie? And I'd rather get something that I know works, that's cost effective for the doctor along with the patient as well. And there are a few contraindications to decompression in general. Certainly pregnancy. We don't want to be strapping in a patient for low back pain if they're pregnant. Certainly an inability to lie down is going to be the other contraindication. If the patient can't lie down, they can't get the treatment. So they're going to be hitting our kill switch, which kind of fell off the table here, but patient would be in control of their care. So if anything did feel like it was getting out of hand, they're able to hit that switch, stops the whole process there for us. But again, if they can't lie down, well, they're not going to be tolerating that care very well. And certainly patients with acute fractures or other conditions, maybe cancers that's actively being treated, we probably want to avoid doing the decompression as well. Now, all of those should already be ruled out during our examination as well. Now, another one that I've dealt with this particular type of model, more so for the neck, is claustrophobia. Some patients don't like to be strapped in, which is understandable, and then that's where we can try a different technique there if we haven't already done it, or another option for them as well. Now, certainly if you had any questions on decompression, if it's right for you, certainly give our office a call, and we're happy to have any one of our providers discuss those options with you as well. But certainly if you had any other questions, concerns, drop us a line, email us here at Coastal Integrative Health, and otherwise, keep your comments and questions coming, and stay healthy, guys.